Hello,
Hello.
welcome back to the channel. In this video we're going to be doing the first of a series of videos chronicling our journey from pregnancy to diagnosis and beyond, and our experiences and what that was like with PDA. So this video will be about pregnancy and birth, and there'll be following videos on the subsequent topics. Before we go any further, if you find these videos useful, please do subscribe to the channel so you don't miss anything, and hit the notification bell, and feel free to share them with anyone you think might find them useful.
Please also leave us a comment as well so that you can tell us if there's any videos you'd like us to make as well. That'd be really useful. We also want to say a massive thank you to everybody who has subscribed and also left us comments as well. It's been really lovely to hear from so many parents being in similar situations to us. There was a lot of comments that said that it's so nice to know that they're not alone, and you really aren't alone.
That's one of the reasons why we wanted to create this channel, to let people know that they're not alone. We remember how it felt, thinking we were going crazy and we must be doing something wrong, and you're not.
We still feel like that sometimes, where we feel like we are alone or we could be doing things better. So doing these videos helps us as well. I think when I first became pregnant with Max, I sort of knew. I had kind of an inkling that something wasn't quite...
How the books put it.
Yeah. During my pregnancy with Max, it was very complicated. There were times when he had reduced movements, and trying to encourage him to move certainly was very difficult. He would only move when he wanted to move, and when we eventually went to the hospital, and we had to have the band put on the tummy to find out, if he was okay, and then he would eventually move and make me look silly. So it was certainly a very different pregnancy.
And then he decided to try and come in his own time.
At 31 weeks, I started getting contractions, and he suddenly decided to try and come. They stopped the contractions and gave me steroid injections, and then at that point he was facing the right way, but then when we got further on into the pregnancy, he decided to be breech and stay up by my rib, and then at 36 weeks I had contractions every 5 minutes for 2 weeks. So I ended up staying in hospital for that amount of time, because I didn't know when he was going to come, if he wasn't going to come, what was going to happen. I was very anxious during my pregnancy with him, because I didn't really know how it was going to go. It was my first pregnancy as well, and I was just very anxious about what was going on.
And it's interesting now looking back at it that he wanted to come when he wanted, and then because he didn't come on his terms, he wouldn't come. So the body was trying to make him be born, and he stubbornly refused to come out, and in the end had to be born by C-section. And even then, I have a very vivid memory of the doctor pulling him out, and almost like him kind of going, "No, flip it back in," and screaming, because it wasn't on his terms. It was already he was having a demand put on him of being born.
My mum was in the other room, literally next door, and she heard him scream, and it was such a distinctive cry, and he didn't really stop either. He was just, constantly screaming. The only time that he really kind of settled was when he was on me, skin to skin. He didn't like to be, in the hard plastic cot. Because I'd had a C-section, we were in the hospital for a good while, and he had jaundice as well, so we were in there for, I think it was about a week in the end.
So 3 weeks in total, 2 weeks before and 1 week after.
Yeah, so a long time in hospital, and the first few days and nights were exhausting, absolutely exhausting. He wouldn't sleep, he would cry all the time, apart from when he was on me skin to skin.
The only way either of us could get any sleep was if the other person sat and held him I obviously had to stay awake because you couldn't lie down with him on you because he was a baby. So we take it in turns. One of us would get some sleep while the other one sat and held him, and then swap over. And I remember quite distinctly sitting in this bed looking at the clock, and I think it was 4 a.m, and counting the hours until your mum
My
came
mum,
and someone else could hold him and I could get some sleep. Because no matter what we tried, or no matter what kind of bed or anything we tried, he wouldn't sleep. And now looking back at it, we can realise that it could have been the clothes from a sensory point of view, maybe were uncomfortable, the bed wasn't right. He'd just gone from being in the only environment he'd ever known to having all these sensory stimuli, which any baby must find difficult, but for a child who has PDA, autism, sensory processing disorder, or however you want to label it, must have been incredibly scary and overwhelming, and no wonder he didn't sleep. And it was only really when we had his brother and we had a very different experience that we started to realise these things. Thanks very much for watching. I hope you found that useful. If you enjoyed the video, don't forget to subscribe, hit the notification bell, and check out the next part in the series, which will be on the toddler years. See you next time. Bye.
Bye.